I know that with my patients, the most important thing I can do for them is listen to them. We're building a partnership together. They advise me about what's happening with their bodies, what their lifestyle's like, and their routines, and I use that information to advise them what the absolute best medical treatments available are that fit their lifestyle and fit who they are as an individual. Despite having worked on a multitude of clinical trials in the past, I know that an evidence-based medicine is really critical to people getting great treatment. It needs to be individualized to each person, and that depends a lot on who they are, how they live their life, and what we can do to help them live their best life possible. I'm an interventional cardiologist, and what that means is I did training first in being a general cardiologist, learning to treat people with medications, and then went on to do additional training in minimally invasive procedures that helps people's hearts. My real passion is for something called structural heart interventions, and that's where my team and I go to replace heart valves, close holes in the heart, or place devices that prevent strokes for patients through minimally invasive techniques. Many of the procedures that my team and I perform are addressing aortic stenosis or mitral regurgitation, other valve problems in the heart. Commonly you'll hear about TAVR for aortic stenosis or Mitraclip for mitral regurgitation. And for stroke prevention, you'll hear about devices like the Watchman device, which is something we can do to help people prevent strokes when they have atrial fibrillation, but who don't want to be on blood thinners. I value both sets of skills very highly. I know that patients benefit from the least invasive and most effective treatment possible, and that is often a combination of medicines as well as procedures sometimes. MUSC is a world-class medical center, and it's the only major academic medical center in the region. They're very motivated to provide an expertise to the people of South Carolina and the surrounding regions. And I joined MUSC because I wanted to work at the cutting edge. That's what I enjoyed doing, and I believe MUSC is putting its money where its mouth is. They're really making partnerships both with patients, with the community, and with companies to help move healthcare forward for not only South Carolina, but for the rest of the world. And I'm excited to see what MUSC has to offer in the coming years.